Time to talk matters of the heart when it comes to our pet. Veterinarians say the heart is a complex organ, and pet owners need to be aware of the diseases it can develop. On this episode of the Paw Report, we're joined by Dr. Gregory Mauck, who will talk about the signs and symptoms of heart disease. So stay with us.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic, located at 140 West Sales Street in downtown Tuscola. More information available at okawvetclinic.com.
Thanks for joining us for this episode of the Paw Report. I am your host, Kelly Goodwin, and joining us for this episode is our friend and segment friend, Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital, who's always gracious enough to join us on the Paw Report again this season. So thank you for joining us.
Yes, always love to be here.
Excellent. And, you know, heart disease is prominent in adults and humans, but heart disease is also what we're talking about today, and it is very prominent in our pets.
Yes, it is actually very common. It's very different than what we see in people. So your typical person with heart disease, people think about heart attacks, strokes, that type of stuff. And dogs really don't get that type of thing, or cats. So people have a lot of arterial disease and get plaques, and we have to worry about cholesterol and all that stuff. And it's a very different situation in dogs and cats. So dogs, and it's kind of strange because dog heart disease kind of depends on how big you are as to what type you get. And we see other things with dogs with that too that are size related, and we really don't know why. It's kind of odd. But little dogs tend to get heart valve disease. Big dogs tend to get heart muscle disease. So yesterday, for example, I had a dog in who was a Doberman, and they actually have a genetic defect where they're very prone to getting heart muscle disease, and that's called cardiomyopathy. So it means heart muscle disease, cardiomyopathy. And so this dog is starting to go into heart failure because his muscle is degenerating and weakening, and so now he's developing signs of heart failure. Little dogs tend to get heart valve disease, especially the mitral valve, which is the valve on the left side of the heart between the ventricle, and the small atrial chambers, so that valve leaks. So when the left ventricle contracts to pump blood out through the aorta, some of the blood back flushes through the defective valve, and which puts pressure back on the lungs. And so that's what develops their congestive heart failure. So it's just kind of odd. We really don't know why that is, why these big dogs get the cardiomyopathy, the muscle disease, and the little dogs get valvular disease. You can have big dogs getting valves and little dogs getting muscle stuff, but it's uncommon. So that's it. That really affects the type of disease you get as to how big you are.
Now, is there a difference, too, Dr. Mauck, between congenital heart disease and acquired heart disease? Now, you've just defined a couple of issues with the larger dogs and smaller dogs, but there is a difference there as well.
Yeah, congenital means that you're born with it. So it's basically a birth defect. So we'll have dogs that are born and have a hole in their heart, people talk about. And what a hole in the heart is, it's a hole or a defect in the wall between the chambers. So as most people know, the heart in mammals has 4 chambers. You have 2 atria, 2 ventricles, And so the ventricles are pumping the blood out of the body. So if you have a hole between the ventricles in that wall, when those ventricles contract, then blood shoots across that hole. Well, the left side of the heart is much stronger than the right side. The left side's pumping it out to the body through all the arterial system in the body. The right side's only pumping it to the lungs, so the right side's much weaker. So if you have a hole or a defect there, when the left ventricle contracts, it'll squirt over into the right side. And then that overloads the right side and things. So that would be a common example of a congenital defect. You can also be born with a defective valve or something. So we have things like that. Acquired heart disease, obviously, is something that develops as you get older. So that would be very typical of these small breed dogs that develop mitral valve disease. So they're totally fine when they're 3, but then when they're 10, they come in, we listen to them, and they've got a loud murmur, and sure enough, that valve has become defective. So that's the two big types. We don't, again, get the type of acquired disease that we see in people, where you develop disease associated with arterial sclerosis, or what people think of as hardening of the arteries and that type of stuff.
What are symptoms? I mean, I think that's probably a lot of people want to know if their dog is acting strange, even their feline is acting strange.
Right.
What are common symptoms, and what are maybe some not so common things that people should look out for?
Right. Well, one of the, and you mentioned cats, and I kind of skipped those. Cats rarely get valve disease. They almost always get forms of cardiomyopathy, which again is the muscle disease. And there's a couple different forms of that. But so cats tend to get the disease more like big dogs get, strangely enough. Mm-hmm. But the type of symptoms that we tend to see that people bring their animals in for is, like for example, this Doberman I mentioned, he just noticed this dog was just not acting right. It would, they would go out to play and the dog wouldn't want to do anything. So we call that exercise intolerance. So you might have a dog who previously we've gone on 3-mile walks, and now you get a quarter of a mile away from home and they're wanting to lay down and do things like that. So that would be a kind of a more vague symptom, but a common one. A little more easily picked up one is when dogs start to cough. So that's quite common with the valve thing. So we'll get these little dogs in, and they're just doing this type of thing, especially if they do it at night. Now, there's lots of other things that cause coughing and they all sound alike. So just because people at home, if your dog starts coughing, don't think, oh my gosh, my dog's got heart failure. It's probably something unrelated, but that would be a common one. So those are really the biggies: coughing and just people just noticing they're just not acting right. Yeah. So.
What about diet? What about weight loss? Anything like that?
Those definitely help because so we have a typical little poodly little thing who's got a valve problem, and she, instead of weighing 12 like she ought to, she weighs 18. And so we've all seen those little dogs walking around. Well, that just puts a lot of extra stress on the heart. The other thing it does is, and people don't think about, you see the fat on the outside, well, there's also fat on the inside. So sometimes we'll shoot an x-ray, and you would be surprised at how much fat is inside the chest cavity. And so now the lungs are having difficulty expanding and things because of that. So that is a big issue, is to keep their weight down.
Is there a difference, Dr. Mauck, between heart disease and heart failure?
Yes, very much so. So you could have heart disease, but certainly not have heart failure. So we think of heart failure as when the organ, or any type, kidney failure, liver failure, any of those things, where they no longer are able to do the job they need to do. So you could have a diseased kidney, for example, who is working on half of its ability, but still is keeping up fine. You only need about 1/4 of your kidney function not to be in failure. So same thing with your heart. You've got a lot of excess heart capacity, and your body can do things to adjust to that. So just because you have some heart disease doesn't mean you're in failure. Failure is when you're no longer able to get the blood around adequately. You're not able to keep the blood from backing up into the lungs where it causes fluid development. Those types of things. But like, for example, I have a heart arrhythmia myself, so I have to take medicine to control my abnormal heart rhythm. So I have technically heart disease, but I certainly don't have any type of heart failure. So we can see those type of things too. So just because a dog walks in who's 10, who's been fine, and we're doing their vaccines, and we listen, oh, your dog's developed a heart murmur. Well, if we hear a heart murmur, they have heart disease. But very few of those dogs are going to be in failure. So at that point, that's when we want to jump in and start doing things to prevent this heart problem from developing into failure.
That leads me into the next question is, what is heart murmur? You've mentioned that a couple of different times.
Right.
You said you hear it. It's an actual...
Yeah, a heart murmur is an abnormal noise we shouldn't be able to hear. So there's kind of a couple different noises, which I've heard both in the last couple days in general. So there's heart murmurs, and then there's heart arrhythmias we hear. So the Doberman yesterday, he actually had both. He had a heart murmur. So what that is, if you listen to a normal heart and you listen to the bump, 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 a heart murmur, which most of the time shows up between those bumps, is because usually there's a leaking valve. And so you can also get it with that hole in the heart. And so it's abnormal blood flow. So you hear, instead of bump, bump, you hear bump, whoosh, bump, whoosh, bump. And so that's the blood whooshing through the hole, if it's a septal defect, or the valve that can't shut properly or open properly. And so the typical little poodle who has mitral valve disease, when that valve's supposed to close, when the heart contracts, it can't shut all the way because of scar tissue, and blood whooshes through it, and we can hear that boom, whoosh, bump, whoosh, bump, like that. So the Doberman yesterday, that dog had a murmur because he has an enlarged heart, and it's pulled his valve leaflets or little doors apart. So now when they close, they don't close together. They can't close. So when his heart beats, blood whooshes through that valve and makes that. The sounds we hear with arrhythmias, which again, this dog yesterday had some arrhythmias, so his heart was beating irregularly. So instead of hearing bump, 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 we're hearing bump, 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 noise like that. If we're getting abnormal beats in there. That dog also had what we call a split S2, and so his heart, instead of going bump, bump, was going bump to dump, like that. So we hear a lot of those things, and that's just one thing. And getting good at auscultation or listening, we can diagnose a lot just by listening to the heart. When we hear those noises, at what point in the cycle do we hear the murmur? Do we hear bump, whoosh, bump, or do we hear a bump, bump, whoosh? And that tells us something. Well, also, where on the chest wall, there's 4 valve areas we listen to. And so we listen, where is that murmur the loudest? So that also helps us pin down where that should be. And so we get that information by listening, and then we look at an x-ray and say, hey, does that make sense? I'm hearing a mitral murmur. I should have an enlarged left atrium. Do I see that on the x-ray? And so we want to correlate what we see clinically with what we're getting on x-rays and things, and to build a case to say, hey, this is what's going on. So that's what a murmur is, just an abnormal noise we shouldn't be able to hear. And it's normally very harsh, but sometimes they're weirdly musical. So sometimes, like, we'll get a murmur that's due to the aortic valve, which is the valve out that the blood's flowing out of the left ventricle into the aorta. So that should open as the ventricle contracts to let the blood out. Well, sometimes it's not able to open much, and we'll see this mainly in young animals, and it's usually a congenital defect. And so it opens partially, and you hear this boop, musical sound. It's the weirdest thing. And then sometimes on these mitral murmurs, they're usually very harsh, but sometimes they don't open much, and you'll hear bump, whoop, bump, bump, whoop, bump. It's very weird. But
The bump, bump.
I don't mean to laugh about it.
Anything beyond bump, bump,
But
there's
yes,
a concern.
yes,
And
yes.
you talk some about your prognosis, or diagnosis, I should say. You start listening, and then you also take x-rays. That's your process?
Oh, yes.
When somebody comes in?
Yes, very important. And what we're looking for on the x-ray is an enlargement of the heart or enlargements of parts of the heart. We're looking at the blood vessels in the lungs to see if they're congested. We're looking at the lung fields and see if we have edema or fluid buildup. So those are the most common problems. So that coughing I mentioned earlier, that comes from basically two issues. So in the lungs, if you have a lot of fluid, that irritates the airways and makes you cough. But also, as the heart, the way that things are, if you look at a dog from the side, his trachea comes in his chest and drops down and sits right above the heart. As the heart enlarges, it pushes the trachea up, sometimes to the point that it's smashing the trachea against the ceiling of the chest, against the backbone up there. But even a small amount of pushing on the trachea, as the left ventricle, the left atrium happens to sit right under the trachea. And that's the first thing that enlarges in these little dogs that have mitral valve problems. And so it just starts to push on it. So it's just like if you walked around all day with your finger on your throat, after a while you start, because that gets irritating. So it doesn't take much pressure on the trachea to cause the coughing. So that's a big issue is doing those radiographs or x-rays to see, do we have heart enlargement? Do we have fluid in the lungs? Do we have congestion? To be able to say this dog's in failure. He doesn't just have a murmur and a bad valve, but hey, we've got changes. We have an enlarged heart and a bunch of fluid. That's heart failure, congestive heart failure. Whereas we could do an x-ray, everything looks totally normal. So this dog may have a murmur, but it hasn't progressed yet.
In the case of the Doberman and other clients, what are treatment options? And I suppose everything that you've just explained, there are different levels of treatment.
There's basically,
generally speaking.
Oh yeah, there's kind of three legs to the stool of heart treatment for heart failure, and one of them is your classic old drug, which is Lasix or furosemide, and that is a drug that pulls fluid off of the lungs. So that is, very important if we've got heart or we've got fluid buildup in the lungs. The big drug, though, for heart failure, which has been, I've been practicing 32 years, and there's about 2 or 3 drugs that have been just absolutely changed everything in the areas that they treat. And this one has revolutionized the treatment of heart failure. It's a drug called pimobendan, and it strengthens the contraction of the heart without needing more oxygen. So digitalis, which used to be the old drug that was used for strengthening the heart contraction, it did so in a way that you need more oxygen. So it's like, I'm going to strengthen my heart, but I need more fuel. Well, in failure, you're not able to get that oxygen there, so it just becomes a vicious cycle. Whereas pimobendan strengthens the heart contraction without the need of oxygen, and it has been phenomenal. So if we have to pick one drug for heart failure, pimobendan would be it. And it has other effects in the body too. So the furosemide to pull the fluid off, and then we usually will use a drug called an ACE inhibitor to decrease the pressure out in the system so that the heart doesn't have to work as hard. So those are kind of the standard things. And we get real good results with those, but it really comes down to heart failure. The basic problem is structural, and we can only do so much with medicine. So we've either got a bad valve. In a person, if you got that, you'd go get a valve replacement, and then you'd be pretty much normal. If you had what the Doberman's got, cardiomyopathy, you'd be on the transplant list. So obviously, neither of those things is going to happen for our pets. So we have to try to compensate as much as we can with medicine, knowing that things may progress to the point where we go into total failure and that's the end of the road. But it really gets down to the individual case. Cases of cardiomyopathy are always bad, pretty much, in dogs and cats and people. If you have cardiomyopathy, your heart is going to fail at some point. Pretty much, we can say that. With valve disease, there's lots of, you basically have a normal heart, but we just have a valve that's leaking. And so if it's not leaking too badly, lots of those animals live completely normal lifespans. We have to help them along with our drugs, but it doesn't cut their life short on a lot of those dogs. Some of them it does, because the leaking is so severe that, that we just can't stop the progression. We can slow it down, but we can't stop it.
I think when pet owners, and I've been there, I had a yellow lab that had an enlarged heart, and I think when you're dealing with anything that has to do with the heart, you panic. But you've kind of just mentioned that prognosis can be positive. I mean, there can be good endings to the disease, as long as a pet owner, and you can talk about this, make sure that you stick to treatment plans. Right.
And there are plenty of dogs who have murmurs with valve leakage that never are treated. They're fine, they have a noisy valve, but they never go into any type of failure, so they do fine. But otherwise, if we do treat them, once we start it, we're never getting off of this. And people have to understand this. It's not like your heart's going to heal. It's never going to be better than it is right now. It's only going to get worse. And so if we are at a point we have to start treatment, then we're not ever going to be stopping treatment. And so, we have to stay on top of that and give the medicines when needed. But also other things, like you mentioned, weight control. Diet can help by feeding low-salt diets, just like with people. That's one of the ways that Lasix works, or furosemide, is by getting sodium out of the body, and that pulls fluid and water with it. So we don't want to be turning around eating a bunch of salt when you're trying to get it out of your system. So things like that. Those are probably really the big things for the owner, but it's not a death sentence by any means.
I thought that, I really did. I mean, my pet was my baby, and when you're messing with her heart, I think that's not a good thing. But as you mentioned, it's not a death sentence.
No, it doesn't have to be. And again, the cardiomyopathies, those are the worst one, the heart muscle disease. Cats get a strange version of that, and this is genetic. And we talked about congenital stuff, you're born with it. Well, these don't show up till you're middle-aged, but they are congenital defects. They're genetic things. So the day this Doberman was born, the day these cats we see with them are born, they are going to get clinical heart disease. It may not show up for 4 to 10 years, but it's going to happen. So they really are a congenital defect, even though there's no way you could see it at that point in time, because it's in their genes. So at some point in time, their heart muscle either starts degenerating, or in the case of a lot of cats, they start proliferating. And so the wall of the chamber of the ventricle, the walls get thicker and thicker and thicker. And so the opening in the middle of the actual chamber gets smaller and smaller and smaller, and so they're not able to get enough blood in there to pump out to the body. It's a very odd thing. It's called hypertrophic cardiomyopathy, and it's just something that can happen in people, it can happen in dogs, but it's mainly we see it in cats. And so, but again, it's just genetics, so.
But keep a close eye on Rover, and if you see anything strange, make sure that you have somebody check it out for peace of mind, if anything.
Yeah.
Dr. Mauck, thank you so much for the
love
useful information, as always, very informative, and I'm sure somebody out there you've answered some questions for them, and hopefully they'll have their pet checked out. So thank
Yes.
you for joining us on
Yeah.
the Paw Report.
Well, thanks for having me.
And thank you for joining us for this episode of the Paw Report on heart disease, and our special guest, Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital over in Sullivan. For more information on the topic that we discussed today or any other topics, you can always visit our website at weiu.net. Thanks for joining us. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com. Additional support for the Paw Report on WEIU is brought to you by viewers like you. Thank you.